You are listening to Veggie Doctor Radio, and this is episode number 212. Welcome to Veggie Doctor Radio. I am your host, Dr. Yami, board-certified pediatrician, certified lifestyle medicine physician, certified health and wellness coach, author, speaker, mother, wife, and human being. I passionately believe in the power of diet, habits, and mindset in sparking and sustaining well-being and joy in our lives. This podcast combines expert interviews and thoughtful monologues to explore plant-based nutrition, lifestyle medicine, parenting, mindset, and other exciting and fun topics. I hope that these episodes inspire you, uplift you, and equip you with the knowledge and tools to live your best life. Are you ready to get started? Let's do it. Hi, veggie lovers. Welcome to another episode of Veggie Doctor Radio. Today, I have Dr. Nicole Harkin, who is a cardiologist and a lipidologist, meaning she is an expert on lipids and cholesterol and all of that. So you're going to love this episode because I know that my listeners always have a lot of questions about heart health and cholesterol and all of that. So we have some interesting discussions. Just to remind you that the information on this podcast is for informational and educational purposes only. It is not meant to replace careful evaluation and treatment by a healthcare professional. So if you have concerns about you or your child's eating, nutrition, growth, any of those things, please consult a healthcare provider. So today, I'm speaking with Dr. Nicole Harkin, who is a preventive cardiologist and is board certified in internal medicine, cardiology, echocardiography, nuclear cardiology, and clinical lipidology. Those are a lot of big words. After graduating from Boston University School of Medicine, she attended Columbia University for internal medicine residency and New York University for cardiology fellowship. She is the founder of Whole Health Cardiology, a preventive telecardiology practice that provides cardiac optimization through precision and lifestyle medicine for patients in California, New York, and Florida. Passionate about preventing and treating heart disease through healthful, sustainable lifestyle changes, Dr. Harkin works with her patients to create a proactive, personalized cardiac care plan. She is also the chief medical advisor for Plate Up, a health tech startup dedicated to improving health through nutrition, and is a member of Planted Forward, a comprehensive multi-specialty telemedicine health team. She proudly serves on several committees, including the American Society for Preventive Cardiology Nutrition Working Group and the American College of Cardiology California Chapter Prevention Committee. She currently lives with her family in San Francisco, California. When she's not doctoring, she spends the majority of her time with her 3 young children. She also enjoys cooking, yoga, Pelotoning, hiking, and traveling. In this episode, we talk about her vegan plant-based journey, why she chose cardiology, what interested her in the heart, why we should all be more interested in knowledgeable about heart health, what are the most common conditions or types of patients she sees in her practice. And then we talk about her top tips for optimizing heart health, what she thinks are the easiest and the hardest for people to integrate. And then we spend a lot of time talking about common myths or misconceptions from other healthcare professionals and from the public. A lot of things about cholesterol. She also answers the question, is it possible to have too low of a cholesterol? That one comes up a lot. It's a great episode. I'm so glad you're here. Thank you, Veggie Lover, for coming back week after week after week. I appreciate you so much. And now let's welcome Dr. Nicole Harkin. Dr. Nicole Harkin, welcome to Veggie Doctor Radio.
Thank you so much for having me on. It's such a pleasure.
All right, well, let's get to it. I want to hear about your vegan and plant-based journey. What brought you here?
Yeah, so it's kind of been an interesting route. I probably a little over a decade ago now, and I need to try to go through photos and figure out my exact date, but I had long been my younger sister, she's a veterinarian, and she had been vegetarian for years and years and kind of had been planting the seeds. And then actually for me, I ended up reading a book Jonathan Safran Foer wrote a book called
Mm,
Eating Animals.
yes.
And it was very much a exploration into sort of the cultural implications of why we eat certain meat that we do. And then very much went through, factory farming and those sorts of things. And just each chapter by chapter, it went through a different animal. And I was like, okay, not eating that anymore. And then that was that. And so for a number of years, I was vegetarian. Every now and then, would eat some fish and things like that. And then it wasn't until my cardiology residency where I started to really understand and have a better understanding of the implications of nutrition and cardiovascular health in particular, and really started diving deep into that literature. One of my mentors actually introduced me to Michelle McMacken, who's at NYU
Mm.
as well. And she sort of really pointed me, here's your 10 journal articles, start here. And then it just kind of really took off from there in terms of really learning and understanding more about how what we eat really impacts heart health. And so that's when my plant-based journey began. And it's just amazing. It just really ties into not only, animal rights, but environmental impacts and health impacts. And so
Hmm.
kind of all three reasons sort of joined together, if you will.
Yeah, so those are all values that you hold, it sounds like. So it made sense in your life. So how many years has it been now that you've been plant-based?
So I went plant-based towards the very end of my cardiology fellowship, and actually dairy, as I'm sure for many, is kind of was one of the last to go. And it actually my now middle child, he developed it was actually difficult because it was a soy and cow milk
Hmm.
intolerance, and I was breastfeeding him, and he was just miserable. And so that was really difficult because I had to cut out soy as well, but cut all of those out. And that's when dairy cut it out, and kind of really didn't go back after that. So it's been about, and he's 4.5. So about that
Yeah.
many years.
That happened to one of my friends too. Kind of similar story. She was vegetarian, and while she was breastfeeding her oldest son, he developed both dairy and soy sensitivity, and so that's when she made the transition too. So very similar story there. So
Once you cut it out, then you like realize like, oh, I can do this. Like there's some
yes.
alternatives, or I can just use avocado, or whatever it is, all the things that we
Mm-hmm.
we now know. But I think it's so embedded in everything we eat, and it's just it definitely was, I think, one of the more difficult things for myself, and then also I find for patients as well.
Yeah, I agree that that's everybody's biggest fear is like, don't make me give up cheese, you know? So,
Exactly.
okay. So, let's back up and tell me how you became interested in cardiology as your specialty.
Yeah, so I actually, interestingly, when I first when I was in medical school, and also early parts of my internal medicine residency, I was actually very committed to infectious disease. Interestingly
Mm.
enough, I was really interested in global health. I'd done a number of different projects abroad, and really that was like my thing. I was so interested in it, and took one small rotation in medical school, and it was kind of interested in cardiology. But then it really wasn't until, honestly, my internal medicine residency. I was at Columbia, which the cardiology program there is just phenomenal, and just really started to really understand that while infectious diseases prior to the COVID epidemic were certainly impactful in terms of death and disability worldwide, actually cardiovascular disease is the number one cause of death globally, men and women, and in every country basically. And so that was when kind of a light bulb went off for me in terms of what is could truly potentially have the most impact on a global scale, and certainly cardiology emerge. And then it didn't hurt that it was just really fascinating. The cardiovascular physiology is just really interesting to me. And it was exciting and interesting. But really it truly came from the fact that I just realized that I had the most potential to really impact a lot of people that way.
Yeah. Well, it's good that you like it so much because that means that you picked the right thing, right? Like it's interesting, it's fascinating. Those are all words for somebody that likes what they do. So that's great. And then you said that you started to learn more about plant-based nutrition in residency and that one of your mentors connected you with another plant-based physician. Do you feel like it was something that was talked about in residency, or was it still kind of like this isolated thing that just a few of the attendings maybe knew about it and talked about it?
Yeah, great question. So actually how I really started becoming interested in the sort of impact that nutrition can have on the development of cardiovascular disease was so in fellowship I'd been interested in prevention. Prevention was always my thing. I was very, very dedicated to the concept of, yes, we need to know all these things once people develop heart disease because we can't prevent it all, but we really got to take a step back and focus on, modifying risk factors and helping people, because it's a continuum, right? It's not just like one day you all of a sudden get cardiovascular disease. It happens over decades and decades and decades. And so I was very interested in prevention. I was taking the lipid boards. I wanted to be board certified in cholesterol disorders. And it wasn't until really PrediMed came out, which for your listeners who don't know is one of the biggest nutrition trials we have to date, randomized controlled trials, looking at the Mediterranean diet and its impact on the prevention of cardiovascular disease in individuals who didn't have cardiovascular disease. And the impact was profound. And I remember presenting it for Journal Club and my cardiology to all of the cardiology, super smart, cardiology attendings. And I remember one very well-respected attending at one point commenting, if this was a new drug, this would be, explosive, right? And that's when I started to really just want to understand more. And then that's when I started really delving into the literature and first saw a lot of the published information about, plant-based diets and, taking it further. What happens if it's not just a plant predominant diet, but a plant exclusive diet? And so that's where, and then it was self-study, unfortunately. So, as I think probably still, I think there is definitely in the last 5 years, increasing understanding of, and it's more embedded within the guidelines. And I think it is talked about more, but as we know, it's just still not a huge focus of most of our training. So I would say it's from my experience, a lot of it was learned afterwards or on my own.
Yeah. In cardiology fellowship, do you feel that you got any training on how to counsel patients on diet, nutrition, or lifestyle habits?
Very minimal. There was a couple, my mentor gave one lecture to us that I recall, but it's certainly not a huge focus by any means. And it's not that people don't want to know. Actually, my fellowship project I conducted a survey, both internal medicine faculty and cardiology faculty, residents and fellows. And it was an anonymous survey. And I asked a series of sort of basic nutrition questions, and then also kind of assess their attitudes and things like that. And it actually was surprising. It wasn't that they didn't know very much at all. They obviously didn't know a ton, but they knew a decent amount. But their confidence was not very high. And they felt like the biggest barrier was that they just didn't know how to do it. They didn't have time to do it, but that they wanted to do it. Mm-hmm. I thought that was really, really interesting. And so I think that, doctors get a bad rap because they're not, providing this nutritional counseling. But I think if we really, truly gave them the tools and the time to do so, we could really make a difference.
Yeah, I agree. I think the more time I've spent thinking about this, I feel it's exactly that. It's not because doctors don't want to, and it's not that doctors couldn't learn it. It's that they don't feel confident enough. It's kind of like doctors, I feel, were very much rule followers. And it's like, okay, we have this study that shows that this helps. Okay, I feel confident saying, let's try this. I recommend this. But if they don't know the data, they're not just going to say it because they're not sure, and they don't want to prescribe something or recommend something that may be harmful, especially when it comes to already having the assumption, which I think is very common, that people are not willing to change their diet and the lifestyle, which I think that's a very common belief among health professionals, is like, well, there's already going to be some resistance. If I mention this, people are going to be like, what? What's wrong with you? How dare you mention that? And so I think there's already that feeling of I don't feel super confident. If they ask me questions, I'm not necessarily going to know the answer to it. So I better not say anything at all. I feel like you're right about that. So it's cool that you did that study. Okay. Why do you think that we should all be more interested and knowledgeable about heart health?
So, I think most importantly, as I mentioned previously, it is the number one cause of death globally and for all genders and ethnic groups. And you name it. Most of us, unfortunately, will develop heart disease. And so I think added to the fact that it is not something, as I said, that just develops overnight. This is something that we know will reliably occur with extended exposure to risk factors. Many of those risk factors, I think, are still emerging, but some of the ones that consistently come out throughout the literature that are well known, high cholesterol, high blood pressure, smoking, diabetes. So, and so many of those can be prevented or treated with lifestyle changes. And so, I think that it's really important to start to realize that this is something that we all should be paying attention to. And it's tempting, in our 20s, we have so many other concerns, or, we're young parents and there's so many other things going on. And I totally get that. But this is the type of stuff that we need to start talking about cardiovascular prevention, not when we're in our 50s and our 60s. We need to be talking about in our 20s and our 30s. And it's really difficult to sort of understand it because it feels so like something that only happens to old people and all this stuff. But one, I'm here to tell you it does not only happen to old people. I have many, many young patients in my practice. And two, it's something that will happen when you are older, and if you're not taking steps to sort of address it early on. And the more we can establish these habits within our families and in those units, the better. Because we have lots of data to show now at this point that cardiovascular risk factors in childhood increase risk of cardiovascular disease later in life. We also have studies that show that young people who die of other causes, there's very famous studies looking at Vietnam War vets, and these young men in their 20s, when they did autopsies, had early signs of heart disease already. And so this is stuff that is important to talk about when we're young so that we can do more to prevent it over the years.
Yeah, and that was before children were consuming 70% of their calories from ultra-processed foods. So it's only getting, like, the standard American diet and the standard American culture is atherogenic, right? So it's like you deliberately have to do something different than just be immersed in this culture and do what everybody else is doing if you're hoping to have a different outcome than we're having, right? Because the lifestyle we have now is producing this outcome of very high cardiovascular disease. But it made me think when you were talking about how we feel invincible when we're in our teens and 20s. It's like so true because, I'm in my 40s now. My husband and I are in our 40s, and he used to never put on sunblock. He's very fair skin, redhead. And I would always be telling him, put on sunblock, you're going to get skin cancer, all this stuff. And now that we're in our 40s, he wears so much sunblock that it like stays on for days. He can't even because we use a mineral based, and we do the boring stuff like wash our face and brush our teeth. And I wear a night guard at night, and I'm getting to the point where it's like, if I don't wear my night guard, I don't sleep well. And I'm like, dang, you suddenly just get to that age where your habits are so important because it makes you feel good, and you realize that it's, you're getting to that age where if you're not sustaining those habits, you're really going to regret it later, but it's harder in your 20s because you do feel like invincible and you feel so good and you can do all kinds of things to abuse your body and you just bounce back, That doesn't last forever, listeners. So those of you in your 20s, take advantage now and start the habits. Okay, what is the most common condition you see or treat in your practice?
So because my practice is very much focused on prevention, I do tend to have slightly younger patients and a different patient population than sort of your typical cardiologist. So while I do have a large portion of patients who have established cardiovascular disease and are really looking to do everything they can to optimize their heart health and hopefully prevent further events, I do have a lot of younger people who have risk factors for heart disease, a lot of people with a strong family history of heart disease, many people who are, say, 40 and their father had a heart attack at 50. And one day they're like, oh my goodness, that is not too far away from now. What should I be doing now? And then also people with cholesterol disorders. Many of those are genetic, also lifestyle related, high blood pressure, things like that. Women who have had preeclampsia or gestational diabetes in pregnancy, that's not a well-known risk factor, but it is a risk factor for future cardiovascular disease. Individuals who have inflammatory conditions like lupus, rheumatoid arthritis, things like that. So certainly have a spectrum of different types of people who are looking to just really make sure they're catching anything early on if it's there and doing whatever they can to prevent it.
That's awesome. And really one of the things you said is that's what you like to do is optimize heart health, and you're really big on prevention. I love that. So can you give us your top tips for optimizing heart health?
Absolutely. I don't even know where to begin. I have so many. How much time do we have? No, I think that so in terms of optimizing heart health, I very much have a lifestyle first approach. So starting with a lot of the important lifestyle changes that we can make. What we eat obviously is a huge lever that we can pull. And so as much as we can consume unprocessed foods, hopefully mostly whole foods that are plant-based, really, as I'm sure you are very familiar with, the literature is very supportive of more and more plants for the prevention of cardiovascular disease. We've got great data from everything from randomized controlled trials showing that a portfolio diet, which is a very high fiber diet with low saturated fat, can decrease cholesterol. We see lower inflammation. I mean, all these amazing things to do. So certainly one of the first places I start with a lot of my patients is how can we incorporate more plants and less processed foods. Exercise is also incredibly important for the prevention of cardiovascular disease. And it's again, also very well documented that getting at least 150 minutes of moderate intensity exercise a week is great for the prevention of cardiovascular disease, up to 300 minutes actually, which is hard to hit, particularly if you're a busy parent, but we continue to really see those benefits. So if you are able to squeeze it in and you enjoy it, that's great. Importantly, I think also with exercise that we sort of forget is that trying to also lift weights, and that's actually a big change that I've made recently, is really trying to also get that resistance training, which we know is great for, there's several studies that show sort of synergistic benefits in terms of cardiometabolic risk factors, blood pressure, insulin resistance, body composition, those sorts of things. Also, just trying to incorporate more movement in our day. So there's studies that demonstrate independently of how much exercise you're getting, how much you move your body throughout the day is also really important. And so, I've tried to do more walking meetings and things like that to really, really mix it up and not always be sitting at my desk. So those are the two areas that I really focus on a lot. And then there's also things like stress management, which is increasingly becoming more important. And we're really realizing the mental health and heart health connection. So trying to work on chronic stress management is a really big thing for many, many patients right now, certainly. And then just really, I think the other big thing that I would urge is just making sure that you do take care of yourself and see a doctor. Many busy parents in particular, but everybody gets busy. But I definitely see a lot of parents in particular who are, so on top of making sure their kids are at the pediatrician and all these things, and then they haven't seen a doctor in a really long time. And so making sure that you get screened for blood pressure issues, cholesterol issues, glucose issues, because these things are silent. You won't know that you have them and so they could be going on for a really long time. And so just, periodically checking in and doing that. And trust me, I'm a terrible patient too. But just, finding time to just do those check-ins with a trusted healthcare professional is really important.
Yeah, that's such a great point. I see that a lot in my office where, I'm taking care of the kiddos, but the parents don't have doctors themselves. So we know they haven't been checked regularly by a physician. And I had Dr. Kim Williams on the podcast recently too. And that was his number one tip: know your blood pressure, because a lot of people don't know. And the body is amazing and it's so great at adapting, which is wonderful, but it means that sometimes you can get really used to feeling how you're feeling and not realize that how you're feeling is not necessarily that good. Your blood pressure could be elevated, you may have some blood sugar regulation issues, and so you don't know unless you actually check. And a lot of people may have never had that checked until they go in and it's really out of control. So that's really, really good advice. And definitely, I think that the stress and the effect of chronic stress on our cardiovascular disease is something that I feel we're getting more and more evidence to show that that's a real thing, that whatever it's from, whether it's from work or whether it's systemic racism or weight bias and weight stigma, these are all things that can definitely affect your cardiovascular health as well. What do you think are the easiest ones that people are able to start integrating, the easiest habits, and where do you feel that people struggle? I love Bernie Wild's adventure sauce so much that I keep a bottle in my work fridge. For lunch, I usually take a grain bowl or a salad, and it's complements my combination of veggies, grains, and beans perfectly. I've gotten pretty adapted to adding a little spice to my food, but I don't want you to forget that spices are health promoting, and the ingredients in this sauce add to your plant points. The first ingredient is actually carrots, but it also includes healthy gut microbiome supporting ingredients like onion and organic white miso. You can use a little or a lot, but I'm pretty sure one bottle won't be enough. The unique combination of ingredients in this sauce leads to a flavor you won't find in another sauce. It's got the spicy kick from the chipotle, but also tanginess and creaminess from the miso. You really just have to try it. Are you curious about this delicious sauce? It's called Bernie Wild's Adventure Sauce, and you have good reason to grab yourself a bottle or two right now. My listeners get 20% off their first order of $20 or more and free shipping. Just use the code Dr. Yami. DRYAMI. Follow the link in the show notes or go to berniewilds.com. After you taste it, I want to know what you think about this sauce. Do you love it as much as I do? Go get yourself a couple of bottles of Bernie Wild's Adventure Sauce right now and get your 20% off and free shipping by using the code Dr. Yami. Enjoy!
That's a great question. Clearly, it varies from person to person in terms of what are their individual barriers, whether it's time or money or all the other competing interests that we have. But I think that actually, interestingly, I find that the message about red meat has really gotten across to, I think, the general public for the most part. And so most people, even if they aren't even plant curious, they're just trying, they're really not interested in going completely plant-based. They're actively have or are cutting down on red meat. And so I think most people find that fairly easy to do, and to substitute it with other things, whether it's the mock meats that are on the market or just, a different protein source. I think that message has gotten out there and people find that not that challenging. I don't have many people that are like, oh, I really miss, my steaks or something like that. So I think in terms of cutting down some of the meat products, people are very receptive to and find not so challenging. I think that for many of my patients, a lot of the other challenges come from finding the time to exercise consistently, if that is if they don't have like a set time that they do it, or they wake up with the kids and then the this and the that, and so really trying to fit that into the schedule, I find, because it's a lot of time, and I find that kind of a big challenge. And so we do a lot of different creative ways to try to help people fit that into their schedule. But just like any habit, once you sort of sit down and prioritize it, problem solve when you're going to do it consistently, tie it to another habit so that you're used to doing it, and start slow, with a goal of whatever it is, 2 days a week, and work your way up, or however it is, and then have an accountability partner. People are able to kind of make it happen, especially even if it seems daunting at first. But I find that that's the big one right now, because I think time is one of our biggest enemies right now, is busy people. We have so many things that we want to be doing, and that's a hard one, I think.
Yeah, it's a precious resource, a rare commodity, is to feel like you have plenty of time, especially when you have young kids. And at the end of the day, you feel exhausted and you're like, how can I even think about exercising or adding this in? Well, I'd love to know what you feel is a common myth or misconception that either the general public have or even healthcare professionals have about cardiovascular health. And I would think, if it is health professionals, maybe people outside of the cardiology field.
Yeah, so I think that there is still a misconception that if your cholesterol is okay, you won't develop heart disease, or if your blood pressure is okay, it's impossible to develop heart disease. And so I think it's important to realize that it's not just one isolated risk factor. We are a lot of things, right? And so there, and with that comes some of the misperceptions around what is a bad cholesterol number. Probably actually one of the biggest misconceptions is that HDL cholesterol, the good cholesterol, is protective. And so if that's high, it doesn't matter what your LDL cholesterol is. So that's another big one, I think, which is very, very pervasive, because there's this ongoing thought that HDL cholesterol, while epidemiologic studies early on did support the notion that if your HDL cholesterol was elevated, you had a lower risk of heart attack. And that is true. We have since learned a lot more about HDL, and we've realized that raising it artificially does not reduce cardiovascular events. And then, in fact, there is such thing as way too high of an HDL cholesterol, and it becomes no longer protective. Yeah. And so sort of simplifying that ratio definitely does a disservice to patients in terms of their true cardiovascular risk. It's much more about the HDL functionality, which unfortunately at this point we can't measure clinically. So I think there's a lot of I think risk and what contributes to cardiovascular risk is still poorly understood by sort of the general medical field, and then also by patients, right? And so I have a lot of people coming in that, for instance, think that because their HDL is high, it's fine, or because their blood pressure is fine, it's okay that their LDL cholesterol is fine, or any number of different things. And so I have seen heart attacks at every cholesterol number, at every blood pressure number, at every body weight, at every, it's kind of all of these things together and how they interact and what's the inflammation like and all of these different things. And so it's really complex. And so we just have to be careful not to take sort of one risk factor in isolation. It's kind of how they all interplay together.
Yeah. Well, one of the ones that I have been hearing increasingly at an alarming rate, especially with the advent of keto and these carnivore diets, is that cholesterol doesn't matter. Like, I flat out heard health professionals say, we know now that cholesterol doesn't matter. Like, flat out say it that way. And that's very confusing to the public, because then there's people saying like, well, my cholesterol doesn't matter. And I'm like, well, yeah, it does. So why is that happening? Why is there so much confusion about cholesterol and what it actually means for our cardiovascular risk, even among health professionals?
Yeah, it's really interesting how you definitely see a lot of sort of dissonance about in terms of how does cholesterol impact cardiovascular risk, what raises cholesterol, right? Because there's that twin misconception that saturated fat doesn't actually raise LDL cholesterol, that dietary cholesterol doesn't affect your LDL cholesterol at all, and then in turn that LDL cholesterol does not increase your risk of cardiovascular disease. And that is just patently false. I think perhaps there may be some extrapolation from some of the data that does show that LDL cholesterol isn't the whole picture. As I said, I have seen heart attacks in people with an LDL cholesterol that I would have looked at and I'm like, oh, that's not that bad. That looks pretty good. But their inflammation was out of control, or their blood pressure, or they just had really high LP little a, or strong family history. I mean, exactly. There's all these other things that go along with it. And so do we miss people who, does LDL cholesterol tell the whole story? No, but it unequivocally increases your risk of cardiovascular disease and is the most atherogenic particle we have that deposits cholesterol into those arteries. And so the more you can control it, the better.
The other myth that I've heard that really rubs me the wrong way is I've heard dietitians, especially when they're counseling parents about children, that children must eat cholesterol because your brain is made of cholesterol and that's where it comes from. It's from your food. And so talk a little bit about this one.
Yeah. So it is true that we need cholesterol in our bodies. They are important parts of our cell membranes. However, our body makes what we need. And so we don't need to consume dietary cholesterol in order to have cell membranes. So I'm not, again, I don't know where that came from. I think it's an impartial understanding of biology, I guess.
Yeah. I think when I think about it, I think the confusion is that we have these essential fatty acids.
Right.
And maybe that got confused with cholesterol. And so then people are saying, well, you have to consume it in order to make enough. And parents, we're scared. Like we want our kids to, they're like literally parents are very afraid that something bad's going to happen to the brain. They can't even verbalize it. I've done these surveys and just talked to parents about what do you think is going to happen? They're like, I don't know, it's just something bad, And so if you tell parents bad things are going to happen to the brain, like they're super scared and they're like, okay, no, I'm not going to do anything that's going to affect my kids' brain development. So if they need to have eggs and they need to have this, and it's very dangerous for them to eat a plant-based diet, then I'm not going to do that. So yeah, that one is, I see that one definitely going around, and that you have to consume cholesterol in order to have proper brain development. So, okay. I have a question that comes up every once in a while. I'm one of these patients. So my cholesterol actually gets really low. So my total and my LDL goes really low. And some primary care doctors get really concerned about this. So I get this question a lot from listeners. It's like, my primary care doctor said this is dangerous, but nobody knows exactly what will happen. So I want to know from you. You are a lipidologist. Tell me straight what you think about low cholesterol. Can it go too low in a otherwise normal person that doesn't have some kind of weird, genetic rare disease on a plant-based diet? And if that's possible, what could happen?
So the short answer is no. There's no such thing as too low of an LDL cholesterol. The slightly longer answer is that we now know from a wealth of different types of data that you can have an exceedingly low LDL cholesterol and have no untoward effects. Some of the concerns of having a low LDL cholesterol came from some earlier studies with a signal towards potentially hemorrhagic stroke, which is a bleeding in the brain, with those who had pushed their LDL cholesterol too low. We've subsequently not seen that relationship at all. And one of the greatest sort of data points that we now have are these massive randomized controlled trials of some of the newest cholesterol-lowering agents that are out there, the PCSK9 inhibitors. So these are injectable medications that dramatically dramatically reduce LDL cholesterol. And so individuals that are on this because of genetically high cholesterol, or they can't get their cholesterol down with diet alone, they have established heart disease. The individuals that use these medications, they routinely get their LDL cholesterols down very, very low, 30s, 40s, 50s. And there's been zero signal of increased risk of anything associated with these cholesterol numbers. And so that in conjunction with genetic data that we have. So there's actually many individuals that have a genetic disorder in which their LDL cholesterol is basically non-existent, and they have normal lifespan. There's no increased health morbidity or mortality implications in those individuals either. And so pretty much every cardiologist I think I know is very comfortable with LDL cholesterol very, very low. And similarly in plant-based eaters, we see that in as well in some plant-based eaters. And so I think from all the data that I have seen, I have no concerns with pushing the LDL cholesterol as low as possible.
Awesome. Thank you so much for that answer. That was very comprehensive. All right, this is great. So I would love to know what you wish more people knew.
What do I wish more people knew? I wish that more people knew that while genetics is incredibly important, it is not the whole story. And so I have a lot of people that come to me with a strong family history, and they just it sometimes initially feel very defeated that this happened to my parents, so it's definitely going to happen to me. And while there are some genetic conditions like elevated Lp(a) that we can't modify with diet, there's lots of things that we can do with diet, right? And exercise and all of these other sort of lifestyle things. And if all else fails, and it is a genetic thing that we can't modify with diet, we do have other medications that are out there that weren't available when your parent was alive. And so definitely, I mean, we've all heard the phrase about genetics loading the gun and whatever else, but it's completely true. And I really I want people to feel empowered that while cardiovascular disease is certainly really can feel daunting to feel like you're going to try to prevent this when a family member had a really early heart attack. There are things that we can do to work on this and help lower it. And so so it's great when we can kind of reframe that conversation and have it be more about taking this on, all the things that you can be doing to help prevent it.
Hey, are you kind of curious about microgreens and including microgreens in your diet, but you're not sure where to start and you're not sure how to do it? I love my Hamama microgreen grower. It's so easy. It's so convenient. So this is how it works. Basically, they send you the kit and it has this little seed quilt, okay? And then you soak the seed quilt in the water, and in a few days, you see your tiny little baby sprouts growing. And a few days after that, you can start eating them. And it's so fun. And you can tell them that you're eating them. And they're really happy that you're eating them. And your body's really happy that you're eating them. But here's the best part, because I've told y'all before, I'm lazy. So I don't want to have to use any mental energy that I don't need to. And they send you seed quilts every month. So you don't run out. You can change what seed quilts you want to try. So here's some examples of some of the seed quilts they have: hearty broccoli, refreshing cabbage, energizing kale, spicy daikon radish, super salad mix. You can even get wheatgrass. You can get culinary cilantro, or even hot wasabi mustard. So there's lots to choose from. They have different flavors. They're so cute and they're health promoting. So you can get a good dose of antioxidants and it's really beautiful. I also use them for garnish when I'm making soups and salads and different bowls. You can impress your guests. But like I said, it's going to be low energy cost on your part, and it's actually not that expensive either. The other thing that I use from Hamama is a green onion growing kit, which is really cool because it can decrease your food waste. So you buy the green onions, and then the little part that has the root, the white part at the bottom, you stick it in these little holes, and then you just put the water in there and it grows, and then you can keep eating the same green onions. You just go with your little scissors and you chop it off and you put it into your food. So if you want to give it a try, you've been curious about microgreens and different ways that you can grow your own food, check out Hamama. You can find it in my show notes for a link to get 15% off, or you can go to dryami.com/shop so that you can find the link and get 15% off your first order. Happy growing! Y'all, I am obsessed with this clothing brand called Ufaray. I initially saw Tabitha Brown wearing one of their bathing suits on Instagram, and I immediately went to the website and bought myself one. Now I have 3 of their pieces, actually 5 technically, considering that I have the cover up for the bathing suit and also the head wrap, and I have 2 infinity dresses. Their clothing is amazing. So they're actually an award-winning African fashion brand featuring beautiful pieces with vibrant prints and bold patterns, but they make you feel like royalty. I wore one of the infinity dresses for my friend's wedding, and I got compliments all night long, but I felt so confident and I just felt so beautiful wearing it. I don't know if you've ever worn an infinity dress. I have never even heard of an infinity dress before, but basically it's a dress that you can style in lots of different ways. So it's like having 100 dresses in one. You can change it according to your mood or what part of your body you want to show off. But the bottom line is you're going to feel amazing. So if you want to check out their pieces, it's Ufaray, Ofuure. But I have a special code so that you can get 10% off of your first order. Ufaray.com/Dr. Yami, Dryami. Okay, so Ufaray is Ofuure.com/Dr. Yami. Also, if you go to dryami.com/shop, you can get to the link right there or check out the show notes. I promise you are not going to regret checking out this clothing brand, especially if you love looking like a queen. Yeah, I love that. And even if you end up being one of those few people that may still need medication despite doing all the lifestyle stuff, there's more reasons to do the lifestyle stuff. You know, it's not just about our heart health, which is super important, of course, but other metabolic conditions and our risk of cancer, but above all, well-being, because it just feels good. It feels good when your digestive system is working well and you're sleeping well and you have the energy and you have the positive endorphins from exercise. So there's multiple reasons. And I think sometimes you hear people, well, it doesn't matter. It's all genetic. So just eat whatever you want. Well, even if it was, there's reasons to choose habits and lifestyles that support well-being and longevity. And that's why I think sometimes it helps to talk about that, because we have some control over how we may be able to feel and how long we may be able to live if we avoid accidents and all that kind of stuff. So yeah, I think that's great. Thank you so much for that. Okay, I want to know about your morning routine. Do you have one? If so, tell us what it is.
I wish I had a better morning routine. My morning routine typically, it depends on the day. So now that I do, I'm telemedicine based, I have a little bit more flexibility throughout my day. But getting back to that exercise component, if I know it's not happening at some other point in the day, that's what happens first. And then, but it has to happen before the kids wake up or I wake them up at 7. So if I either get a little extra sleep because I know I'm doing that later, or I get up and do that, and then it's kid time, and it can sometimes be crazy and hectic, but it is what it is. I try to fit in my meditation and those sorts of things in the evening, just because I know that the mornings are crazy, and I know it's simply a stage of life. But we do the wake up and the breakfast together, and then out the door. And I actually really am really loving taking taking them to school right now. It's been fun. It was not something that was an option for me previously. And so doing the school drop off and just, trying to chat with them or just listen to music quietly together on the way to school has been nice. And then I start my day as a cardiologist.
I love it. That's lovely. And you're a Pelomaniac as well.
Yeah.
Who's your favorite
really
instructor on the Peloton?
So I'm pretty partial to Allie or Cody. If they're one of them, they're the OGs for me. Like they've been riding with them forever. And so I love them, but honestly, any of them, it just depends on, music and the time and all that kind of stuff. But those are my two favorite. And then actually recently, as I mentioned, I have started to do a lot more weight training, and that has been, I think, one of the more, impactful changes in a while that I've just kind of noticed. So I've really been trying to, while I'm such a cardio junkie and I would love to just do a ride every single day, I had to force myself early on to try to do some of the weightlifting classes, which you can get cardio with too. You can do some of the, the combo stuff, which is great. And I think that's been a really good change in the last couple, I would say 6 months or so for me.
Yeah, I'm the same. I have to be really deliberate about my strength training because I would rather do cardio all day long. I used to run half marathons and marathons. I could do that hours, no problem. Make me lift weights and I'm like, do I have to? So, but it's good. It's made a big difference. And just like those other habits, once you get to my age, if you aren't deliberate about it, is not happening. You just start losing that muscle mass and it takes longer to build it back up. When I was younger, I could literally do push-ups for a week and my triceps would they would pop out. It was like, and I thought that was going to happen again when I started again. I'm like, where are my triceps? But they're back now. So now I'm just like very conscious about, I can't quit because it's going to take so much longer to build it back up. So it's very important. Okay.
Absolutely.
So pretty similar. What personal habit are you most proud of and why?
I think for me, it took me a while to get on the meditation bandwagon, just simply because I think as I mentioned earlier, it was just like not realistic happen in the morning and then evening craziness and da. And so I think, I'm most proud that I actually am finally doing that. It's not long. It's usually 10 minutes or 20 minutes, but I use an app, and I've been really proud of myself that I've been sticking with it. Because that was something that I had always wanted to do. And then I would do it and then I would stop. And so I kind of, again, tying it to, it's part of my bedtime routine now. And so again, tying it to something else that you're already doing, you brush your teeth, you get your mouth guard, you and then it's meditation time. So in a perfect world, would I do it in the morning to start my day? Yes, it's not realistic for my lifestyle. So you do something else. Right. So I'm glad that I've started doing that more.
Well, I bet it helps you sleep better though. Did you notice any differences in your sleeping when you started meditating at night?
I think it probably has improved it a little bit, although ever since having kids, I've been the lightest sleeper in the entire world. It is not that hard for me to go to sleep, but I wake up all the time. Yeah. So that's actually my big sleep issue, as I'm sure it is for many parents. But yeah, I do think that it has improved sleep also probably because it got me off the device, which, being really intentional about not having device time for that hour or so before bed. And so trying to be more intentional about reading a book and meditating and other things. And so certainly that helps sleep.
I love it. And I love asking this of my guests because I want listeners to see that this is not just like, just because we're experts and just because, we talk about this stuff, it doesn't just mean it automatically happens for us. We also have to be deliberate. We also have to trial and error. And sometimes we fall off our habits, but we know that it's something that we value. And so then we get back on or try it a different way. And just like you're saying, your life changes. Like my kids are now 12 and 17. So I can have lots of morning time to myself, when before, I remember when they were little, as soon as they wake up, it's like a tornado just hit the house and you're not going to do anything for yourself. Definitely no meditation. So no. I remember when I tried to when they were little, and I would just be more frustrated because as soon as I would start meditating, somebody would barge in or bang on the door and I'm like, oh my God, this is not working.
Yeah, exactly. No, and I think that's really important because too often people are so hard on themselves about these things. And I think I find my role more often than not is not just cheerleader, but like reminding people, give yourself grace. It's like none of us are perfect. Even those of us who preach it, there's all kinds of things that happen, and it's not about being perfect. It's about being as consistent and doing your best as possible. And then if it's not working, modify it, figure out how to switch it up and stuff. And and we're all constantly, learning and on our journeys, and things change, and, so yeah, I think it's really important to be very open and honest about our challenges as well.
Absolutely. Well, Dr. Harkin, this has been amazing. I would love for you to tell us where we can connect with you and what products and services you offer.
Yeah, so I am a preventive cardiologist, and I provide telemedicine appointments to patients in California, New York, and Florida. Those are the states I'm licensed in. And so if you happen to live in one of those states and you'd like to see a preventive cardiologist, I would be more than happy to be your doc. So you can find me on www.wholeheartcardiology.com. And then otherwise, I'm on Instagram off and on, but at Nicole Harkin MD, and I like to provide education about various cardiovascular topics, lots of stuff about nutrition and plant-based eating, but lots of other cardiovascular topics as well.
Awesome. Okay, last question. Leave us with your favorite number one tip for busy parents who want to optimize heart health for their children.
I love that, because as we've discussed, heart health starts early. For me, I think one of the once my kids started to get a little bit older, one of my favorite healthy habits is to have them and enlist them to help cook. And I think that my kids, as I'm sure you counsel your patients, my kids are so much more likely to eat things that they've helped prepare. And so it's just fun. So we've got the kids' knives, we got the little stool, and my 4-year-old, if I let him, could like make a smoothie on his own at this point. Like he knows all the ingredients. Get the flaxseed, get the this. It's so cute. So we really like cooking together, and I was really proud when my kiddo came home one day and had one of the cards for me, and one of his favorite things to do with me is cook. And I thought that was really sweet. And so it is having an impact. He does enjoy it, and it's fun. And then they can play around with food. And if it's, they can try stuff they wouldn't normally try. Maybe they like it, maybe they don't, but that's not the point, right? So that's fun. And I like that. And I think that it exposes kids to stuff early on, and then it's a family affair, because I really do think that heart health, cardiovascular prevention, just health in general is, when it's centered around your family, it makes it so much easier to really to take charge of it.
Yes, that's so beautiful. And it's such an invaluable skill. Like I started deliberately having my kids cook on their own on Sundays. And one of the reasons I did is because my oldest one is going to be a senior in a day. I can't believe it. And, he's going to be on his own, and I want him to be able to make more than just like a microwave meal or whatever, not dissing microwave meals or anything, but just that I want him to be able to feel comfortable in a kitchen, to be able to have the skills to prepare a meal that feels good to him. And it's a gift for their future partners too. Like you can always tell their future partners that, hey, I made sure that they learn how to cook, so thank me. It's the gift that keeps giving.
Absolutely. I love that.
Well, Dr. Harkin, thank you so much for joining us on Veggie Doctor Radio. Thank you for everything that you do. I love your passion and your energy. So thanks for coming on, and I hope that you have a very plantastic day.
Thanks so much for having me on. I loved it.
I really enjoyed that conversation with Dr. Nicole Harkin. She's so eloquent, she's so knowledgeable and passionate, and I just love the work that she's doing. Here are my top takeaways. We should all be more interested in cardiovascular health, because it's going to touch us all in our lives at some point, whether it touches us personally or a family member or a friend. So we should all be interested in cardiovascular health and in our own cardiovascular health. Nutrition, exercise, and stress reduction are some of the key pillars in optimizing your heart health. Number 3, know your numbers. If you don't already know your blood pressure, if you don't know if you have an elevated fasting glucose, these are all things that you should see your doctor about. Get tested, know where you are on the spectrum so that you can work on optimizing those numbers. Cholesterol does matter, despite what you may hear on the internet and from other influencers. Cholesterol really does matter, but it's a complex topic. It's not black or white. So be wary of people saying that it doesn't matter if your cholesterol gets elevated if you're eating a certain way. And then finally, if you're a whole food plant-based eater and your cholesterol numbers have dropped super low, don't stress about it. It's okay. It's not dangerous. And there's studies that show that nothing bad's going to happen to you. So those are some great takeaways from this discussion. I loved meeting and talking with Dr. Nicole Harkin. I hope you did too, and that you will reach out to her if you are interested in her services, if you are living in the state of California, Florida, or New York. Thank you so much for hanging with us, Veggie Lover. I hope that you have a very plantastic week. Hey, Veggie Lover. I hope that you loved today's episode. Will you take a second and do me a huge favor? Please subscribe to my podcast so that you never miss an episode. You're the reason I'm here, and I want to share it all with you. Thank you for listening, and have a plantastic day.